Okay, so I'm going to start with sodium. It is a positively charged ion. It is closely related with the same effects as chloride. It accounts for 90% of all positive charged ions in the body and helps regulate the fluid balance. Hypernatremia is anything above 140 due to sodium gain or water loss. The signs and symptoms are dehydration, thirst, fatigue, tachycardia, fever, confusion, muscle twitching, dry mucous membranes, excess. The causes are excess IV hypertonic salt solutions and Cushing syndrome. Hyponatremia is anything less than 135 milliequivalents per liter. Usually, this is signs and symptoms of this are nausea and vomiting, confusion, oliguria, headache, dizziness, malaise, thirst, seizures, coma. Salt intake, excess water intake. Yeah, so like that water challenge, don't do that. Anyways, chloride is our next one. It is a negative charged ion, so it's an anion. And remember, it follows sodium. It provides electroneutrality. First, we have hypochloremia, which is anything above 105 MEQs per liter. The signs and symptoms of this are not specific, but it mimics hypernatremia, follows it. So watch for those signs and symptoms because it'll indicate hyperchloremia. Hypochloremia is anything less than 97 MEQs per liter. Again, the signs and symptoms are non-specific to this, so you just want to treat the underlying causes. Hypochloremia is usually associated with cystic fibrosis and metabolic alkalosis. Then you have potassium, which is a positive charged ion. It's cation. It's the major intracellular electrolyte that we have in our body. It is found in most body fluids, maintained by our renal excretions. Hyperkalemia is anything over 5 MEQs per liter. Signs and symptoms of that is dysrhythmias, nausea and vomiting, bradycardia, anxiousness, muscle twitching, tingling sensation in your extremities, mainly caused by fluid shifts from intracellular to extracellular or from decreased kidney function. Hypokalemia is anything less than 3.5 MEQs per liter. And keep in mind anything below 2.5 is life-threatening. So that's something you want to keep in mind. Signs and symptoms are muscle weakness, heart palpitations, mood changes, and nausea and vomiting. Usually caused by loop diuretics, excessive vomiting or diarrhea, hyperaldosteronism, which is a disease that affects your adrenal glands. Something you want to keep in mind is hypo and hyperkalemia. Both affect the electrical activity of the heart. A lot of times hypokalemia will cause heart palpitations, and you'll have a lot of people present in the ER thinking that they're having a heart attack when really they're just low on potassium. So that's something you want to keep in the back of your mind and kind of look for. Magnesium is our next one. It is a positive charged ion, so it's a cation as well. It is our second major cation that we have in our body. 40 to 60% of this is stored in our muscles and our bones. Hypermagnesemia is anything above 2.5 MEQs per liter. Signs and symptoms occur when level is significantly elevated. So if it's just slightly elevated, you probably won't have any signs or symptoms in that realm. But when it gets significantly elevated, they'll start kicking in. You'll have muscle weakness, confusion, decreased reflexes, nausea and vomiting, hypotension, respiratory depression. Things that can cause the hypermagnesemia is renal failure, and also can be caused by excessive use of antacids containing magnesium in them. So hypomagnesemia is anything less than 1.5 MEQs per liter. Signs and symptoms are depression, confusion, dysrhythmias, irritability, increased reflexes, ataxia, nystagmus, tetany, convulsions. It is associated with insulin-resistant diabetes, left ventricular hypertrophy, and systemic inflammation. It relates a lot to hypocalcemia, so a lot of your things will mimic each other with those two things. Causes of hypomagnesemia is alcoholism, loop diuretic use, and malnutrition. Calcium is our next one we're going to talk about. It is a positive charged ion, so it is a cation as well. Total body content is 1,200 grams. It is normally found in your bones mainly, regulated by the parathyroid. Hypercalcemia is anything greater than 12 milligrams per day or daily. Signs and symptoms are anorexia, fatigue, weakness, lethargy, nausea and vomiting, constipation. Mental status changes may also occur if your level gets too far elevated. Things that can cause hypercalcemia is hyperparathyroidism, hematological malignancies, sarcoidosis, which increases your calcium levels, and excess vitamin D intake. If you stay consistent in hypercalcemia for too long, it can also create kidney stones, cause them to develop. And also, if you're doing an ECG, it can show shortened QT segment and depressed widened T waves on your ECG readout. And parathyroid tumors can also cause hypercalcemia. So hypocalcemia is 8.5 or anything less than. It is related to inadequate intestinal absorption of the calcium in your system. Signs and symptoms are tingling, muscle cramping, bone fractures, stomach cramping, hyperactivity bowel sounds, or hyperactive bowel sounds. Causes are inadequate intake of vitamin D or inadequate exposure to sunlight, and loss of parathyroid hormone in your system. Our last one we're going to talk about is phosphate. Phosphate is a negative charged ion, so it's an anion. It is 85% found in the bones. It provides energy for muscle contractions. Hyperphosphatemia is anything greater than 4.7 milligrams. Signs and symptoms related to low calcium levels and similar symptoms to hypocalcemia. When prolonged calcification, when hyperphosphatemia is prolonged, you can have calcification of soft tissues in the lungs, joints, and kidneys. Stuff that causes hyperphosphatemia is acute and chronic renal failure with significant loss of glomerular filtration, long-term use of laxatives or enemas containing phosphate, and hypoparathyroidism. Hypophosphatemia is anything less than 2.0 milligrams. Signs and symptoms are leukocyte or platelet dysfunction, irritability, confusion, numbness, convulsions, coma. It can also lead to respiratory failure, and all that can lead to rickets and osteomalacia. Causes of hypophosphatemia are use of magnesium, aluminum-containing antacids, alcoholism, malabsorption syndrome, and respiratory alkalosis. Thank you.